Welcome to UMCC Medical Consultants Connectors, where your health matters to us. A fracture is a broken bone. It's a common injury affecting millions each year. Fractures range from hairline cracks to complete breaks. The goal is to restore the bone's alignment and function. This is where fracture reduction comes in. It realigns bone fragments to their correct positions. Think of it as solving a jigsaw puzzle. The aim is a stable, functional union for optimal healing. There are two methods: closed and open reduction. The choice depends on the fracture type and severity. We'll explore these methods in the following sections. Understanding these aspects is crucial in orthopedic care. Closed reduction is a non-surgical procedure used to realign bone fragments without making a large incision. It is typically the preferred method for simple fractures where the skin is intact and the broken ends haven't shifted dramatically out of place. During closed reduction, the orthopedic surgeon uses a combination of manual manipulation and traction to guide the bone fragments back into their correct positions. This is often performed under sedation and local anesthesia to minimize pain and discomfort for the patient. Imaging techniques like X-rays or fluoroscopy are used in real time to guide the surgeon and confirm the proper alignment of the bones. Once the bones are properly aligned, the fracture is usually immobilized using a cast, splint, or brace. This helps maintain the reduced position, prevents movement, and provides stability to the injured area, promoting optimal healing. Closed reduction is generally considered a safe and effective method for treating many types of fractures. It is less invasive than open reduction, resulting in fewer complications, shorter recovery times, and less scarring. However, its success depends on the complexity of the fracture and the surgeon's skill in manipulating the bone fragments without directly visualizing them. Open reduction, as its name suggests, involves a surgical procedure to access and realign the fractured bone. This method is typically reserved for more complex fractures, such as those where closed reduction has been unsuccessful in achieving proper alignment. The fracture is unstable and prone to displacement even after closed reduction. There is significant soft tissue damage, such as an open fracture where the bone has pierced the skin, or the fracture involves a joint and requires precise alignment to restore joint function. During open reduction surgery, the surgeon makes an incision to directly visualize the fracture site. This allows for direct manipulation and accurate alignment of the bone fragments. Depending on the complexity of the fracture, various surgical implants such as plates, screws, rods, or pins may be used to fix the fragments in place and provide internal stability. Open reduction offers several advantages, particularly for complex fractures. It allows for direct visualization and precise alignment of the bone, potentially resulting in improved functional outcomes. Additionally, it allows for the treatment of associated soft tissue injuries and the stabilization of unstable fractures that cannot be adequately managed with closed reduction alone. Section 4. Weighing the benefits and risks. Both closed and open reduction techniques have their own sets of benefits and risks. The most appropriate method for a particular fracture depends on a variety of factors, and the decision is made by the orthopedic surgeon in consultation with the patient. Closed reduction, being a non-surgical procedure, is generally associated with lower risk of infection, less pain and scarring, faster recovery times, and reduced need for hospitalization. However, it may not be suitable for all fractures and there is a chance of incomplete reduction, meaning the bones may not heal perfectly aligned and the need for a second procedure if closed reduction is unsuccessful. Open reduction, while more invasive, offers greater accuracy in aligning bone fragments, the ability to address complex fractures and associated injuries, and improve stability and fixation, especially for unstable fractures. However, as with any surgery, it carries risks such as infection at the surgical site, nerve or blood vessel damage, complications related to anesthesia, and longer recovery time compared to closed reduction. Section 5. Ensuring proper healing, the key to recovery. Proper fracture management is crucial for optimal healing and regaining full function. The fractured bone needs to be immobilized to allow the bone fragments to knit back together. This is usually achieved with casts, splints, or braces. Pain management is essential. Medications alleviate pain and reduce inflammation. Physiotherapy restores strength and flexibility. Following the surgeon's instructions is paramount. Regular X-rays monitor healing progress. Fractures are treatable injuries. With proper care, most individuals can expect a full recovery. Understanding fracture management empowers patients to achieve the best outcomes. UMCC, your ultimate medical consultants connectors.